name is Donna. Mike and I own the trolley company here in Jefferson City. We've been operating for about 4 years. We do everything from historic tours to weddings to Christmas light tours.
Anytime that you're held back from doing as much as you want to do, that's going to stress you out, and I don't need that kind of stress. I'm very involved in the Jefferson City community, serve on a lot of boards from the Downtown Association to the East Side Business, Old Town, and then I own businesses here. My dad had broken his neck over the summer, and I was helping take care of him, and one night was helping him in bed and lifted. I kind of, felt a twinge when I was helping him, but I didn't think anything about it. It's just, that happens. But when I got back in bed and did the big stretch, at that point I felt something pop, and I heard this horrible popping noise. And I had severe pain down my arm, my back, my hand, and so forth. And I thought I did something. That next morning and next couple days, pain in my arm got worse and the numbness got worse in my hand. So I called my regular doctor, and he referred me to Dr. Lehmen. And Dr. Lehmen took a look at me and said, yeah, I think there's a problem.
When Miss Dietz came to my clinic, her issues were relatively acute, but they were very debilitating for her, and it was neck pain and even more so arm pain. And when I reviewed her MRI, she had a big disc herniation that was sitting on the nerve on that side. And then, based on her symptoms, based on her exam, based on her story, I discussed with her, we can see how this does with physical therapy or injections. It may be a better idea to maybe talk about a surgery, and that's when I discussed with her what we would do.
My son Chris is a trauma surgeon at the University of Wisconsin in Milwaukee, and he was the first person I called. After I went and visited Dr. Lehmen, I said, Chris, this is what he wants to do. He says, Mom, I'll get back to you. Well, he went and researched Dr. Lehmen, and Chris had done some work at Harvard University at the same time, I guess, that Dr. Lehmen was training there as a surgeon. And he called me back and said, yeah, this is how he checks out. This is what I know about him.
What I try to do is as much minimally invasive surgery as I can. And what we found is that it's great because people go home the next day or they go home the same day and they're back up on their feet quicker.
Going to the spine center there at St. Mary's, everybody's very friendly, tell you what's going on. And that's one of the things that I appreciate, because I don't have time to just sit around. I need to get answers to what I need. I need to find out what's going on, and then I need to get it done. And that's what happens when you go over there. To get back to full capacity is about 3 months, although I was able to do things with not any real problems about a month earlier than that. I just watched what I was doing and made sure that I wasn't overlifting or over-moving and things like that I shouldn't have done.
Given that my part, from a technical aspect, went well in surgery, that's a very good start. The other side of that is to have the patient follow through with compliance, and she was great. She didn't do too much too soon, and she didn't do anything too crazy, no heavy lifting.
Life's back to normal, my usual run 24/7 type schedule, and don't have any flaws to worry about or anything that's incapacitating me. At the time I can lift and do and pick up and go wherever I need to go, and just everything goes on as usual.